Jared Lilly, 6'8", 2021, acromegaly. So first I want to break down what acromegaly's word components are. So first we look at the word root, or the combining form, acro, which stands for extremity/height, and the suffix megaly, which is regular enlargement. So when defining a medical term, you look at the suffix and then the word root. So for this word, it means irregular enlargement of the extremities of the body. So what is acromegaly? Acromegaly is a rare disorder and is characterized by the pituitary gland producing excess levels of growth hormone, GH, in other words, over a long period of time. So the pituitary gland is located at the base of your brain, behind the bridge of your nose. Produces many hormones, one being GH, which regulates your physical growth. So it regulates your physical growth by your pituitary gland producing growth hormone, which travels through your bloodstream, reaches your liver, which then stimulates the production of IGF-1, which stands for insulin-like growth factor. This causes your bones and other connective tissues to grow. So the more growth hormone you have, the more IGF-1 that is secreted. The most common cause of this hypersecretion of growth hormone is a benign adenoma in the pituitary gland. Most adenomas form from an excessive growth of the pituitary cell called a somatotrope cell. Another rare cause of acromegaly is the ineffective growth hormone secreting cells by the hypothalamus. So sometimes too much GHRH, growth hormone releasing hormone, is secreted by your hypothalamus, causing the acromegaly. So to test for acromegaly, the most common test is a blood test, and it's called growth hormone suppression test. So during the test, your growth hormones level is tested before and after you consume a drink of high concentrated sugar. So if you don't have acromegaly, if your body is normal, then your GH level will fall. Another way to test is via imaging. So you can have an MRI, which can show the location and size of the tumor, which will help diagnose and create a treatment plan for the patient. So some symptoms of acromegaly are prognathism, which the lower jaw protrudes, malocclusion, which is the widening and separation and misalignment of your lower teeth, enlarged hands and feet, osteoarthritis, general hypertrophy. We'll have type 2 diabetes, and then if the lungs and heart are affected, then we'll see dyspnea when people breathe in, and arrhythmias with their hearts. Also, I believe it's a quarter of the people who are diagnosed with acromegaly have hypertension. So there's a couple treatment options. The first is surgery, which can help reduce and improve the symptoms of acromegaly. You can also get injections of somatostatin analog medications, and that can help regulate the hormone levels and hopefully normalize them. And if you can't normalize your hormone levels via medications, then an alternate form of therapy would be radiation therapy, and it's kind of like the last resort. Radiation can damage other things as well besides the target location. So the last treatment option is radiation, which will help regulate the growth hormone levels. But the downside is this can take several treatments over a long period of time. So you're exposing yourself and your body to unwanted radiation. So hopefully you can either suppress some of the symptoms via surgically or using somatostatin medication injections. Thank you.